Which of the following is the traction epiphysis trochanter of femur? Which is the most prominent spinous process? C1, that is cervical one. Which of the following bones has no medullary cavity? Clavicle. Coracoid process is a atavistic kind of epiphysis. General visceral fibers do not supply skeletal muscles. The lesion of Klump's paralysis is in lower brachial plexus. Dorsum of the middle finger is supplied by radial nerve, median nerve, and ulnar nerve. Sensory supply of the tip of the ring finger is median nerve. Brachialis is supplied by radial and musculocutaneous nerve. Extension of the metacarpophalangeal joint is lost in injury to radial nerve or posterior interosseous nerve. If the greater tuberosity of the humerus is lost, which of the following movement will be affected? Abduction and lateral rotation. True flexors of the elbow joint are biceps, brachialis, and brachioradialis. Ossification in fetus starts in 5th week of intrauterine life. Abduction of the shoulder joint above 90° is trapezius and serratus anterior. The following is true of brachial plexus. Radial nerve arises from posterior cord. Axillary nerve injury at its origin leads to paralysis of deltoid and teres minor. Winging of scapula is due to paralysis of serratus anterior. Relation of musculocutaneous nerve with axillary artery in axilla is lateral. Following an incised wound in the front of wrist, the subject is unable to oppose the tips of the little finger and the thumb. The nerves involved is median nerve alone. Lymph node which is first to be involved in carcinoma breast is pectoral group. Cancer breast of upper outer quadrant mostly spreads to pectoral. Nerve damage affecting movements of thumb, median nerve, ulnar nerve, radial nerve, posterior interosseous nerve. In an ulnar nerve lesion proximal to the elbow, there would be a sensory deficit involving the skin on the ventral aspect of medial 1.5 digit. Thumb adduction would be lost. Clavicular part of deltoid is associated with flexion and medial rotation. Each of the following has an attachment to scapula except. So pectoralis major does not have any attachment to scapula. Pectoralis minor, biceps brachii and triceps are having attachment on the scapula. The following structures are attached to the greater tuberosity of the humerus except. So greater tuberosity of humerus has attachment for supraspinatus, the coracohumeral ligament, teres minor muscle and infraspinatus muscle. Subscapularis muscle does not have attachment on greater tuberosity of the humerus. Boxer muscle is serratus anterior. Uh, all the rest. The ulnar nerve is medial to the ulnar artery. The ulnar artery is lateral to the tendon of flexor carpi ulnaris muscle. The radial artery is lateral to the tendon of flexor carpi radialis muscle. The median nerve is the interval between the tendons of the palmaris longus and flexor carpi radialis muscle. Which of the following nerves are branches of the posterior cord? Radial nerve and axillary nerve. The glenoid cavity of the scapula is rotated upward by which of the following muscle? Serratus anterior and trapezius. The muscle of the rotator cuff include teres minor, subscapularis, supraspinatus and infraspinatus. Adductors of the hand at the wrist joint include flexor carpi ulnaris and extensor carpi ulnaris. The first bone to ossify in membrane is clavicle. A patient is found to have pus in the mid-palmar space. The space is a space lying medial to fibrous septum attaching the palmar aponeurosis to the third metacarpal bone. The medial collateral ligament of the elbow joint is closely related to the following structure: ulnar nerve. Axillary nerve arises from posterior cord. Root value of ulnar nerve is C7, C8, T1. Musculocutaneous nerve supplies all of the above. Which tendon is frequently absent in the hand? Palmaris longus. Which structure does not pass through the carpal tunnel? Ulnar nerve does not pass through the carpal tunnel. Medial nerve, radial bursa and ulnar bursa pass through the carpal tunnel. Following muscles cause retraction of shoulder except. So retraction of shoulder is caused by trapezius, rhomboid major and rhomboid minor. Serratus anterior does not cause retraction of shoulder. The quadrilateral space is bounded by the following structures except the deltoid. Quadrilateral space is bounded by surgical neck of humerus, long head of triceps, teres minor and teres major. Which of the following bones does not form the proximal row of carpal bone? Capitate. So which bones form the proximal row? Scaphoid, lunate and triquetral. Carpal tunnel syndrome is due to the compression of median nerve. The structures taking origin from the tip of coracoid process are short head of bicep and coracobrachialis. In the region of the shoulder, the glenohumeral joint permits flexion, extension, abduction, adduction and both internal and external rotation. Medial cord of the brachial plexus gives rise to all except. So it gives rise to ulnar nerve, medial cutaneous nerve of arm and medial cutaneous nerve of forearm, but it does not give rise to nerve to supraspinatus. Regarding serratus anterior muscle, which is incorrect? Originate from lower right rib is incorrect. What is correct is that it is a multipennate muscle, lifts arm above the shoulder, and it is supplied by long thoracic nerve. Radial nerve 2 inches distal to the elbow joint gives muscular branches and sensory branches. Fracture of the surgical neck of humerus results in flat shoulder. Root value of axillary nerve is C5, C6. Root value of radial nerve is C5, 6, 7, 8 and T1. Root value of musculocutaneous nerve is C567. Wrist drop is seen with injury to radial nerve. Musician's nerve is ulnar nerve. The term eye of the hand applies to median nerve. The first and second lumbricals are supplied by the median nerve. Labral nerve is median nerve. Artery present in the anatomical snuff box is radial artery. Deep branch of the ulnar nerve supplies the following muscles except. So, deep branch of the ulnar nerve supplies adductor pollicis, first dorsal interosseous, third lumbrical, but it does not supply first lumbrical. Muscles that can flex the forearm include all except. So which muscles flex the forearm? Brachialis, brachioradialis and pronator teres. And coneus does not flex the forearm. Ossification center of the medial epicondyle appears in 5th year. Nerve responsible for the fine movements of the hand is ulnar nerve. Muscles that can extend the middle distal phalanx or the index finger include all except. So, which are the muscles that can extend the middle distal phalanx? The first dorsal interossei, the first lumbrical, the second palmar interosseous. Extensor carpi radialis longus does not extend the middle distal phalanx of the index finger. The prime flexor of metacarpophalangeal joint is lumbrical muscle and dorsal interosseous muscle. Ulnar nerve supplies all except. Nerve not related to humerus is musculocutaneous. Structure piercing the clavipectoral fascia is cephalic vein and thoracoacromial artery. Which is correct regarding deep palmar arch? It is formed by deep branch of ulnar artery. Muscles of the hypothenar eminence are innervated by ulnar nerve, which is not a branch of posterior cord of brachial plexus. Ulnar nerve. So which are the branches of posterior cord of brachial plexus? Thoracodorsal, radial and axillary. Ulnar nerve supplies all of the following except. So ulnar nerve supplies flexor digitorum profundus and dorsal interossei, but it does not supply abductor pollicis brevis and extensor carpi ulnaris. The medial wall of the axilla is formed by serratus anterior. The following structures form the boundaries to the superior entrance into the axilla except the coracoid process. So which structure form the boundaries to superior entrance into axilla? Clavicle, upper border of scapula and outer border of first rib. The coracobrachialis assists in which movement of arm? Flexion. The movement affected following axillary nerve injury is abduction. Injury to radial nerve at wrist leads to none. Musculocutaneous nerve of the arm supplies brachialis muscle and coracobrachialis muscle. When median nerve is paralyzed in carpal tunnel syndrome, which of the following occurs? Flexor pollicis brevis paralysis. Axial artery of upper limb is derived from 7th cervical intersegmental. Injury to ulnar nerve at wrist causes paralysis of adduction at thumb. Lower border of scapula corresponds to D7. Which of the following arteries does not take part in scapular anastomosis? Anterior circumflex humeral artery. All of the following are sequelae of musculocutaneous nerve injury except loss of supination of forearm and loss of flexion of arm are not a sequelae of musculocutaneous nerve injury. So, which are the sequelae? Loss of flexion at elbow and sensory loss over lateral area of forearm. Serratus anterior is supplied by long thoracic nerve. No supply of brachialis is from musculocutaneous nerve. Posterior interosseous nerve of upper limb is a branch of radial nerve. Rupture of supraspinatus manifests as difficulty in initiation of abduction. The nerve supply to pronator teres is median nerve. Median nerve supplies abductor pollicis brevis. C8T1 supplies all muscles except extensor indicis. C8T1 supplies which muscles? Third and fourth lumbricals, abductor digiti minimi, and palmar interossei. Nail bed of thumb is supplied by median nerve. Tip of coracoid process of scapula gives attachment to short head of biceps muscle. The structure that is least likely to be compressed in flexion and abduction of shoulder joint, suprascapular nerve. Metacarpophalangeal joints are flexed in the paralysis of radial nerve. Following groups of axillary lymph nodes are distributed along lateral thoracic artery, anterior set. Deep branch of ulnar nerve does not supply second lumbrical, but it supplies fourth lumbrical, palmar interossei, and dorsal interossei. Blood supply of breast is from all except. So, blood supply of breast is from internal mammary artery, intercostal artery, and thoracoacromial artery. It is not supplied by thoracodorsal branch of subscapular artery. All are sensory except. So, which are sensory? Saphenous nerve, sural nerve, and intercostobrachial nerve are sensory, while long thoracic nerve is not sensory. Lower angle of scapula at the level of T7.